Dr. Preeti Prabhakar. I'm a senior consultant at Apollo Hospital, Bangalore Road, Bangalore. Today we'll be talking about something called preconceptional counseling. So what exactly is it? Preconception is a time period about 3 months prior to the actual pregnancy or the conceiving of pregnancy. And preconceptional counseling or care is a set of intervention that aims to identify and modify the risk factors, be it social, be it behavioral, be it medical risk factors, that is to optimize the health of the lady during pregnancy and have a good pregnancy outcome. Now, what is done during this is we screen for various issues, whether it is through the personal history, whether it is the medical history, the history of surgeries, whether it is the family history. Apart from that, we also do something called laboratory screening to look at various biochemical parameters, and along with this we also look into the genetic history or in terms of genetic disorders in the family that we are dealing with. So what it helps is, it helps in preventing certain issues, because we usually look for parameters which need correction, whether it is thyroid, whether it is sugars, whether it is blood pressure. So these parameters we look for correction, and we look for a good state, healthy status in the woman. If she's anemic, correct the anemia, and if there's any chronic illness, if she's on some medical treatment, we have to also deal with whether these medicines are safe during pregnancy. If not, are there any alternatives to that? This also is the time where we actually start certain prenatal vitamins called folic acid, which goes a long way in preventing neural tube defects in the baby. And apart from this, the social history, the personal history, we try to look at addictions, whether it is alcohol, whether it is smoking, and because all that has to be stopped prior to planning a pregnancy. This is also a time that we screen for sexually transmitted infections and diseases, screen for HIV, screen for infections which can cause premature labor, preterm labor, pregnancy losses. This is also a time that we look into, like I had said earlier, genetic disorders in the family, so that we can actually do parental karyotyping or look for the carrier status in the partners, because then we can give the parent an idea about what are the chances of the baby carrying the genetic disorder that runs in the family. So all this goes a long way in reducing the morbidity, mortality, whether it is maternal or perinatal. It also reduces the chances of certain congenital anomalies, because we look into vaccination statuses, whether it is whether the person is immune against rubella, whether the person is immune against varicella. And it also goes a long way in reducing the possibility of pregnancy losses and premature labors and infections during pregnancy. So this is definitely a must for a healthy pregnancy and a healthy outcome for the couple.